Hello class, my name is Julia Solis, and this is my presentation for a research study that we've been working on this semester. The topic that I've chosen was the impact of the new Office and Civil Rights guidance rules and their effect on the processes within the Health Information Management Department. I began my paper with an abstract, kind of going back to the beginning with HIPAA, the Health Insurance Portability and Accountability Act of 1996, which for HIM, the main focus of HIPAA was on patients' rights and how those rights affect our processes within HIM. And since they came into effect back in April of 2003, there have been quite a few changes as far as what some of those rights are and how they're carried out. One of the most current changes was published by the Health and Human Services, and those were the Office of Civil Rights guidance rules, which gave more focus. And it wasn't really a change; it just kind of enhanced and reiterated what HIPAA initially expected and what their intentions were as far as the rights of the patients and how they could access copies of their medical records. In my introduction, I just give a little information about patients' ability to access the medical records without any hindrances. This is one of the things that the Office of Civil Rights, the OCR, guidance rules focus on, that there shouldn't be any barriers for the patients to be able to receive their records. Barriers could be anything such as not having a proper authorization form. What type of authorization form is being required by facilities? Are they being too stringent on the information that's required to be on the forms? Another thing that I kind of addressed on was acceptable delivery methods when releasing the healthcare information. What is the OCR guidance rules stating that that are acceptable methods of delivery or releases for information upon patients' request? And what are some of the acceptable forms that can be used with the required elements that are needed as stated through the guidance rules? Then another topic that I touched on were how some of the facilities, well, a lot of the facilities, how there's a need for the understanding and concise interpretation of what the guidance rules are telling us from information that I have read, from information that I have heard through conferences and discussions and webinars. There seems to be a lot of different interpretations and what the guidance rules really mean. Little background information on and some of the questions that that I wanted to focus on for my paper. The guidance rules and how they affect the individuals, the patients, and accessing their records. Um, the guidance rules also discuss requests that don't just come from the patient. What about the other requests that we receive from third parties, from business associates? How are those going to be handled? Are they all going to use the same type of request form? What's required? When HIPAA first came into effect back in 2003, it was very set out for us on how or what the authorizations for copies of medical records had to have. There were elements that had to be on there, and to be HIPAA compliant, it had to have all these elements. And many of our requests, I've worked many years in the release of information, and there were many requests that we had to return because it didn't contain all the required elements that HIPAA stated that needed to be on the authorization. And those were all roadblocks to some of our patients. Many times we got calls and complaints from our patients that they're losing their insurance benefits because they haven't received records. And they didn't receive records because we had to return it for an authorization form that was HIPAA compliant. So those are some of the roadblocks that the patient has encountered. And now with the new guidance rules, they have changed this, that we need to be more lenient. We meaning the HIM professionals, have to be more acceptable to request and the request of the patients and how they're asking us to go ahead and release the records. And those 10 elements that were required back when HIPAA first came into effect are not required any longer when it's requested by the patient. Some of the methods that we need to do to address, and I know that my facility, when the Office of Civil Rights Guidance Rules first came into effect, we had to call a meeting between HIM, a representative from our legal department, representative from our compliance department, to see if we can get a concise decision on how we were going to determine the type of request that was going to be required from our patient, and then what types of requests were going to be required from third parties. And when we say third parties, from my understanding, what I've heard, and there's been a lot of different interpretations, a third party could be a request coming from an attorney's office. And even though the request that we received has an authorization signed by the patient, it's still coming from a third party working on behalf of the patient. So those requests have to have some elements that are required through the Office of Civil Rights guidance rules, and not as open and lenient as a request coming directly from the patient. Another set of requests that we receive are from some of our business associates. Business associates could be insurance companies working on behalf of the patient to pay their bills, to pay for the services that the hospital has rendered. So there's different forms that we have to decide on using for these different types of requests. Another thing that we have to decide with the different types of requests are what fees we're going to charge for the records and what delivery methods. Fee schedule that the release of information has always followed is a fee schedule that's set by the state of Texas through the Texas Health and Safety Code. And it changes once a year at the beginning of every fiscal year in September. And the fees are established, as I said, through the state of Texas. And those are used by hospitals. Hospitals are allowed to charge the fees for records according to this Texas Health and Safety Code. Now, HIPAA does say that the fees that we charge to the patient should be a reasonable fee, and that we can only charge really for what it's costing us, meaning the labor of our frontline staff, the supplies that we're using, and the time that it takes to copy the records. So all of these have to be taken into account, because now with the OCR, it's even more lenient to where they're saying if the patient's requesting it, if we receive a request from the patient saying send it to my attorney, then that's what we're going to charge that attorney, is the more reasonable fee that we would normally charge the patient. So what I know for my facility, for one, we are our income coming from for the request that we release has really decreased. Another thing that was touched on by the Office of Civil Rights is the method that we're able to release the records. Historically, we've never, we meaning the HIM department, would never release records via email, especially outside of our secure firewalls within our facility. Because of their information not being encrypted, and the possibility of being used in a way that's not acceptable to the patient. But now the Office of Civil Rights say if the patient asks us to email them to their Yahoo email, their Gmail account, that's what we have to do. The only thing we should make sure and ensure that we tell the patient the possibilities of what can happen to their information once it leaves our secure firewalls, the possibility of their information being stolen or being hacked or being used for other reasons. So these are all things that have to change our processes within HIM. The way that we've always done our business has been one way. Now we're having to change procedures, or written procedures. We're having to change our policies just to abide by the new guidance rules that were set by the Office of Civil Rights. I gave a little copy within my paper of the model that I used, talking about the Office of Civil Rights and then some of the effects on the HIM department. And it just goes in to say, some of what I've already spoken about, the forms that we use, fees to be charged, how to differ the different types of requests one from the other, and then the methods of delivery for our records. I gave a little section within the paper on just giving a discussion about the Office of Civil Rights, gave some publications, more information, just discussing about the changes and process that we're having to do within HIM. Um, just as a conclusion, I gave just a little background about myself, about having worked in the release of information for many years, and the way that I've always known HIM to be has really changed with the Office of Civil Rights, has changed our processes. And I know that there is one thing that I did touch on in my paper also is that I've always really fought management on not wanting to outsource our processes because the processes that we do are done by our frontline staff. And if we outsource, then it's those frontline staff will no longer have a job. So I've always wanted to keep it in house, keep it with my staff that I had there working, and not wanting to go outside. But now with all the changes, less money being received, and just different ways that we're conducting our business, I think more and more, once we really look into it, it may be a more financially feasible way to do business is to outsource because it will be a savings in money on the facility if we were to do it in that manner. And then I gave my last frame was just on the references that I used for my paper. Thank you, and I hope you enjoyed my presentation.